Welcome to this presentation entitled Managing Medical Emergencies in the Dental Office, How to Prepare Your Emergency Drug Kit. My name is Brian Oglander with Southwest Oral Surgery. Appreciate you tuning in. This is the first part in a series of presentations regarding how to manage medical emergencies in your office. Today we want to talk about the 6 essential medications you're going to need in an emergency drug kit. Here's an example of a commercially prepared drug kit. Many offices may have something like this. There's a lot of injectables. There's a lot of other adjuncts in this particular kit that we may or may not need in a medical emergency. These kits are not inexpensive. These run about $300, $400, $500, especially the ones that contain the EpiPen. Here is a smaller emergency drug kit, a little bit simpler form. There's a lot less injectables. Certainly, there's some oral medications here that we may need for medical emergencies. This looks like a much cleaner kit, and this is what we're going to strive to put together in our office. This is a more functional kit, and this is going to be a lot less expensive than what you'd buy from a supply company. Why do we need an emergency drug kit? Well, here's a nice guy. This could be a patient of ours. Older gentleman, may have some significant cardiac history. We don't know, but our patients are getting older. A lot of patients are coming into our office with more medical issues. A lot of patients are presenting on different medications, all these newer medications that are out there. As dentists, we're going to see a growing population. We're going to be able to, or need to be able to manage medical emergencies in our office should we need to, and if these situations arise. Commonly encountered medical emergencies, adverse drug reactions are generally number one. This would be your palpitation from local anesthesia or possibly allergic reaction from local anesthesia. We also see here change in mental status, shortness of breath, chest pain, diabetic complications. Cardiopulmonary arrest in the dental office is pretty low. Procedures associated with the occurrence of medical emergencies, usually tooth extraction or pulpal extraction, root canal. Makes sense. These are procedures where patients' anxiety is really high and patients may have either infection or significant pain prior to the procedure or possibly during it. Timing of the occurrence of most medical emergencies in the dental office, usually during local anesthesia, is the greatest chance for us to have an issue, most likely the adverse drug reaction, but certainly during treatment and after treatment as well. We have to remember, too, a lot of times the rides for patients or bystanders, other people in our office, may have some type of issue. We may have an issue with a new assistant in our office who doesn't know she's allergic to latex and suddenly develops an anaphylactic reaction. Or we could have a ride, one of our patients in the office have a hypoglycemic episode that we're going to need to know how to manage and address. The ADA Commission on Dental Accreditation, in their 2016 guidelines, states that dentists must be competent in providing basic life support, including CPR, and be able to manage medical emergencies. So let's get to it and start putting our drug kit together.